Hi, we're live again. It's Dr. Stephanie and Alicia from Dakota Natural Health Center. This is now our third video talking about thyroid issues and thyroid health. And today we want to talk about the kind of what comes next. So, fair question. We've had a lot of phone calls in that regard. You know, if I do this kind of testing, well, then what? So let's just fill you in. So I'm going to talk a little bit about, like, from a clinical side, what do we do after we do the test? And Alicia's going to talk a little bit more about, like, from a lifestyle perspective, what can you do, or what do you do after results of a thyroid test? So to be very specific as far as what are we going to do after this particular test that we're doing, we are going to, so I'm the one that will do the blood draw for the thyroid test. You'll see me for that part. It's not actually an office visit. It's just, hi, nice to meet you, let's get your test done. Then about 10 days later, 10, 12, 14 days later, we'll get the results of those tests from the company that we've worked out to do these tests at a low cost for us. And once I have those results, with your permission, which will be part of the paperwork you fill out when you're here, I will email you a copy of your results. If you're not comfortable with email, we'll send them in the mail, that's fine. And I will also give you, essentially, I will write an interpretation of the results that you've received. So, you know, this marker was off, here's what that means. This marker is off, here's what that means. So just to try to put it in some type of a context for you. What you do after that point is going to vary dramatically based on the person and based on the results. So in some cases, the next best step, if things say we do notice on this test that your thyroid is in really bad shape, the next part might be going back to your primary care and talking about some type of a thyroid medication. That's possible. That's always a possibility. On the other side of things, you know, from a naturopathic doctor's clinical perspective, there may be room for conversation about nutritional therapies. Are there different nutrients? And again, we stick pretty close to just evidence-based nutritional therapies when something like endocrine disruption. So, you know, what can we consider from nutrient perspective? Maybe dietary perspective, maybe additional testing, like looking at other hormones that both affect and can be affected by thyroid, adrenal, cortisol output for one, sex hormones would be another potential. So all of that will come to you in this, you know, interpretation that I will write up based on your results. Now, the fact that I'm just doing a blood draw and then delivering the results, essentially, it doesn't make me your doctor, so I'm not going to diagnose, I'm not going to prescribe, I'm not going to get that specific, but I will help you to understand what the information means and where to go from there. And that will, of course, vary based on the person, but you'll get your money's worth. We're not going to leave you hanging, that's for sure. Mm-hmm. So that's kind of just the medical rundown or the clinical rather rundown of what you can expect. We've talked a little bit before, you know, Alicia was okay with us sharing that she's gone through quite a bit with her journey with hypothyroidism secondary to Hashimotos thyroiditis. If you tuned in yesterday, you know that that's an autoimmune condition where part of the thyroid gland is essentially under attack by the person's own immune system. So it's handled a little bit differently. So she's going to share a little bit about, from more of a patient perspective or a lifestyle perspective, the things you can do outside of the clinical realm to potentially improve thyroid outcomes.
Mm-hmm. I'd say, first of all, learn as much as you can. I've read so many different books, and that's the way that I've really learned about my body and about how the thyroid works and what things can be done to improve the thyroid. There's different supplements you can take as a patient. There's different diets you can start to do, taking out gluten, taking out dairy. A lot of those things really affect how you feel. My main thing with the thyroid is it's how you feel. So you have to base it on what your body is telling you. You have to really listen to your body, and it's a slow process. It's not going to happen overnight. You just really have to be in tune with when you start something. Just take notes, keep a journal, see how you feel in 3 weeks, in 2 weeks, and see if it makes a difference. Another thing is to find practitioners that are going to listen to you, that will take the time to sit with you. Dr. Stephanie is a great person that you could make an appointment with, and she can become part of your team. And don't be afraid to doctor shop. Unfortunately, that does happen, but you need to find somebody that's going to listen to you and what you're saying, because it's not all about the numbers, it's about your lifestyle, how you feel, and your journey through all of this.
And I can't even tell you how many people are told things like, well, it's all in your head, maybe you need to try an antidepressant, and there's a time and a place, don't get me wrong, but often there's more that can be investigated before those types of, assumptions should be made.
Definitely. I've been through all of that, so.
Yeah. So, again, we're going to come at you again tomorrow with another video. Friday is still our Q&A, so if you have questions that we can answer for you or consider as part of that panel, we would be more than happy to do so. Just post them on this video or send them in a private message. If you're interested, the Thyroid Lab is coming up on March 6th. We're considering extending that also to March 7th because of the level of interest that we've had. And if you want more information about testing and scheduling and whatnot, you can call the office here, which is 701-258-9418, or again, email, post a question, whatnot. We'll be happy to let you know or answer your questions. All right. See you next time.
See ya. Thanks.